Hiya. Okay, mate. I'm Smithy.
Yeah, Chris. Yeah. We're still doing that.
Yeah, you got it, mate. You got to introduce yourself.
Yeah, I guess that's what professional podcasters do.
Yeah, because we are professional.
Yeah.
That's why I wonder why we're doing it.
Now we're going to catch up last week to do this one, but we had a couple of things pop up and we had to delay it. So here we are again. Finally got ourselves together.
Yeah.
Going to hit peptides.
Yeah, pretty interesting little topic, eh?
It is,
Pretty interesting big topic.
Yeah.
Yeah, pretty in the limelight these days, aren't they?
Yeah.
Yeah, probably since your scumbag football club cheated.
Wow. We're still going to drag up ancient
Yeah.
history, are we?
Oh.
Well, it's funny you look at it now, isn't it? Because back then it was so taboo, wasn't it? Everyone was what are they doing? But if you,
Well, for those that don't know what we're talking about, Essendon Footy Club got done for the use of peptides, and the more you research into peptides, the more you learn that they weren't really doing anything. Well, I know that peptides had with ASADA and sort of sport and drug affiliates.
they are illegal.
But what they were actually taking weren't really performance enhancing. They were more aligned with recovery, joint maintenance and stuff like that, injury prevention or injury maintenance.
But performance enhancing in that they could recover quicker. That means
I guess indirectly it could be performance enhancing, but yeah, it's
a couple of
still
red and black glasses on over here. You too.
Full disclaimer, a couple of Essendon supporters on this podcast of three.
Yeah, but I mean, I had a look at the type of peptides, and we'll go into that a bit later. I had a look at the list of peptides that they were accused of taking, and they were pretty tame, really. We'll talk about them later.
Yeah. But interestingly, with a lot of the science that's coming out on peptides now, really, should everyone be taking them? You know, I
exactly.
don't know. I guess, having said that, if you can go in to the doctor and ask for a prescription, like I did, the doctor said, "Well, look, mate, I'd really love to. I know that they're going to work really well, but the science doesn't tell us that." And,
is that right?
Get the fuck out of here.
Yeah. I appreciate you looking into it, but I can't do that for you. And
because as a doctor, I'd rather you have ailments as you get older, and I don't want something that's going to prevent all these ailments and you stop coming to me.
Well, his argument was that my shoulder's a little bit sore, bursitis. The first thing they want to do is give you a corticosteroid shot. And I said, "Oh, look, well, what about all these other things? Peptides, PRP, platelet-rich plasma. We can probably talk about it in another episode." But he said, "Look, the science is definitive on corticosteroids, that they are somewhat effective." I think he said 80% or something ridiculous, something like
as
that.
As a quick fix or as?
Didn't really go into it.
Yeah.
Isn't that what medicine's about these days? Give you a Band-Aid, give you a pill to cover up your symptoms, then we'll give you another pill to take away the side effects of the current pill you're taking, and everything's good. Yeah. Just take it for the rest of your life and you'll be fine.
He did say, he recognised that, I don't think he didn't say pseudoscience or anything like that, but he said the science is not definitive on it yet, and did he say we would get in trouble? Something along those lines of not really allowed to, but anyway.
I did find that a bit in my research, so I find the peptides really interesting and really compelling, and there's heaps of sort of anecdotal evidence and heaps of biochemistry into how they work and all that stuff, but there's not really any clinical trials in humans.
Double-blind placebo.
Exactly right. You're not going to find your randomised control trial where where they're looking at a control group and a treatment group and all that sort of stuff. So hopefully they do it. Because there definitely seems to be some pretty big benefits.
So let's start with what is a peptide? Let's go with that.
That's a great start, mate.
Which is also what they are actually helps explain the reason why they shouldn't really be illegal, because they're just basically a replica of a chain of amino acids that your body already produces itself.
Yep.
So they're basically a precursor, aren't they? Or they're called a growth hormone secretagogue. So they're a precursor to growth hormone. So we produce growth hormone via our pituitary gland, I gathered, and that growth hormone helps us, increases every bodily function that we require. Not just muscle building, but cellular mitochondrial production and function and that sort of thing.
So a peptide is a small, like, fraction of a protein, 2 amino acids or more joined together. It's a protein, right?
Yep.
So they say peptides are anything less than 50. Depends who you ask. Because
Yeah.
growth hormone is 191 amino acids joined together, and they say that that's a peptide. But for argument's sake, I think they say anything more than 50 amino acids joined together is a protein. Anything less than that is a peptide.
Gotcha.
2 of those joined together make proteins. So, yeah, basically, they are amino acids, 2 or more amino acids joined together
In a chain.
in a chain
It's in a certain sequence, isn't it?
Yeah. that then make a protein. Yeah.
I read somewhere, think of it like like beads on a bracelet.
Oh, yeah.
You know, so like all those amino acids are the beads, and they're all linked together to form a peptide.
Yeah.
Yeah. So fairly, like you say, fairly straightforward, made by the body
Yeah.
themselves. So when
Would you
you look at
ask me?
it, when you look at it that way, it's kind of, yeah, maybe worse than cheating. Yeah, definitely. But you know,
definitely taking amino acids in a certain sequence.
yes, yeah, yeah,
Yeah. Yeah, I mean, I come up with the same as you in terms of what they are. There's different definitions floating around. Some websites will tell you it's 100,
yeah,
less than
Yeah.
100 is a peptide, and more than 100 is a protein.
yeah,
But exactly that, it's just amino acids joined together in a certain sequence in a chain, and they seem to have like a biological effect on the body,
Yeah.
like Rooster said. So they'll obviously stimulate the release of growth hormone, or they can help with injury repair and a range of other things. And I mean, when you're just dealing with amino acids, just from a layman's point of view, it doesn't sound super dangerous, does it?
No.
You're not dealing with a chemical cocktail of drugs. You're really just dealing with proteins.
yeah,
So,
yeah.
And when we talk about that chain being 2 or 10, 20 or to 50 amino acid chains long, that number of amino acids in that chain determines the function of that peptide.
Yep.
So each bodily function has its own peptide basically providing it, and that peptide is made up of a certain number of chains dependent upon that bodily function. Does that make sense?
Yeah,
Yeah.
yeah. And I mean, one of the things I came across, which, you look into it, it's quite obvious. Things like insulin is a peptide, it's a peptide hormone. So we all have insulin in our body. There's also another famous one kicking around at the moment, which maybe we'll get into later, the Ozempic craze for weight loss.
Ooh, man.
I've
yeah.
got some very interesting
That
stuff
is a
on
big
that I'd
one,
love
isn't
to
it?
dig
Yeah.
into later, but that's peptide.
It's a whole other topic, that one.
It's a whole other topic.
Yeah.
It's a whole
Yeah.
other podcast, but maybe we'll touch on it briefly because it seems
Yeah.
to be absolutely epidemic proportions at the moment, particularly in the US with their prescribing of it, and they're even prescribing it to kids, 12-year-old kids and stuff now. Just one weekly injection for the rest of your life to stave off obesity. Don't worry about your diet or your lifestyle or anything like that, or play sport. Just
Exercise, yeah.
come and get your jab.
Get outside for more than 4 minutes.
So yeah, tons of things are peptides. A lot of hormones and things like that.
Yeah.
So yeah, definitely very very naturally occurring in our body, and I guess some of these other more performance-oriented ones, which we'll probably go into more detail with, just have a slightly different biological effect. And like you said, it's mostly on growth hormone.
Yeah.
And then growth hormone is going to go downstream and stimulate IGF-1, insulin-like growth factor 1, and then you're going to get all your anabolic effects and other benefits of it. So
Yeah.
so you're essentially upregulating something that your body already does. Your body already makes growth hormone. Growth hormone already stimulates IGF-1. You're essentially just tipping the scale in your favour a little bit.
Yeah.
So
if someone's artificially taken peptides, but they're just putting into their body already just like an artificial, synthetic, for want of a better word, version of the peptide, of a peptide that your body already produces.
Does your body already produce that exact peptide? I'm not sure on that. I'm not saying that's wrong. I actually don't know. If you guys have come across
That's what I gathered from what I'd read. So basically, to say if you take a certain type of peptide, then that will be a similar structure already in your body.
I see. Yeah, so you're making the same sort of shape molecule that's then going to fit into receptors and things like that.
Yes.
Yeah. Yes.
Yep. And importantly, it shows, and this is one thing for me that I've, I'm 52 now and have realised recovery after exercise and training, and even like maintenance of muscle density and that sort of thing is a little bit harder. I found it important where it says here growth hormone levels decrease by approximately 1% each year that you age. So if we're looking at a 1% decrease as we age in growth hormone levels, that answers or gives reason as to why you become sort of like a little bit decrepit as you get older. Like you're not growing anymore. You're going backwards. So your bone density, your muscle strength, skin health, fat burning, and all your hormone balances are all controlled by your growth hormones. And if those are decreasing every year of your age by 1%, it's going to add up. And
you're literally fighting a bit of a battle, aren't you? It's not like you can just attain a level and then maintain it. It's actually harder and harder just to maintain, as you go on.
That's right. And going back to your first comment, CJ, that you just said there, why isn't everyone on them?
Yeah.
It sort of would explain why people should be on them as they get older, to keep those growth hormone levels up.
Yeah. Well, they've been completely banned in the US now, haven't they?
Yeah.
Which is really interesting.
Yeah,
because
it is.
The big pharma companies can't patent them because they're a natural amino acid, so they can't make any money out of them.
Yeah.
So what do? They ban them, and then but Ozempic's all right.
Yeah.
It's just
it's
it's just funny
nefarious,
how
isn't it?
it's just they obviously work pretty well, because if they didn't, there were heaps of side effects. Like you said, side effect, you get another pill, and then big pharma would be all right.
Everyone's happy, baby.
Yeah.
Well, I think also big pharma are working on more research into this, and I think they will develop more products. So, obviously Ozempic and some of the... So Ozempic is semaglutide is the name of... Ozempic is like the drug name, and semaglutide is the chemical name. And there's a couple of different versions of that available. Ozempic's the most well-known one, but for example, with that, I know people have been getting phenomenal weight loss. So some people have been getting like a 10% body weight reduction over only 1 or 2 months. But what they're finding is they're losing a hell of a lot of lean muscle mass and even bone density. So I do hear the pharmaceutical companies now talking about, well, maybe we need to get you on some other products that will stimulate muscle protein synthesis and assist with bone density. And I'm sure they're looking down the line of different peptides.
Yeah.
So then they can give you one, and then the side effects of that are this, then we can give you another one. So then you become a repeat customer, and round and round we go.
We've got you.
We got you. So I don't know how they have managed to patent some of these formulations, like some of these peptides. Maybe they add something to it or tweak it in some just slight way that then they can put a patent on it.
That's all that's required, isn't it? One small little tweak to it.
One small tweak.
Yeah.
Yeah, because I did see, I think it was the FDA or the CDC or one of those American bodies came out warning against like compounding chemists and even like institutions who have the equipment to make their own peptides, warning against like not making home version Ozempic, because even though you could just work out the chain of amino acids to make it, well, that could potentially be dangerous. So you better get it off whoever owns it, Pfizer or I don't know who it is. So I mean, that sounds like a joke, doesn't it?
Yeah.
If you have a sequence and it's 36 amino acids or whatever, and this is the sequence and you make it, it is what it is. Doesn't matter.
We're making the safe one.
Yeah.
Don't make it at home.
As a safe, because it comes in an orange bottle with a little lid on it, and a little name on it, with a price tag.
Yeah. Well, so should we look at the benefits of them? I mean, and I know different peptides have different benefits. They have different functions or purposes, and therefore different benefits. But overall, generally, there are a number of sort of overall benefits of peptides, including
most definitely.
The obvious is increase in muscle health, bone density, and even sports performance by some of these peptides. And I think GHRP6 is one that's been identified as one of those. Also, muscle and joint repair. So there's BPC157, I think, is really renowned for repair of and helping of joint mobility and joint pain and stuff like that.
Mate, that one sounds
Tendons,
amazing. Out of all the ones I researched, it's not going to sort of put heaps of size on you and make you into a beast in the gym, but far out in terms of healing.
Yeah.
there's some pretty compelling stuff behind that, which
Yeah.
we'll probably dig into.
BPC 157.
BPC stands for Body Protective Compound,
Yeah.
Right.
or something like that.
Yeah, that's right. Yeah.
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 So
And I think even like going back to the old Rogan, I think Rogan talks about that a fair bit.
he has, yeah.
And really is a big believer in it.
Well, that one and TB 500 are the two big ones for
Are they?
older fellas, I think.
Yeah,
'Cause they're
right.
good for healing tissues and tendons and joints and nerves and
Yep.
Yeah.
I think they're stacked together sometimes.
Yeah. Yeah, so increase in muscle strength, bone density, decreased exercise-induced muscle damage, increasing joint health and mobility, and even some of them increase muscle mass.
Mm.
Yeah, and then you get the increases in sleep quality as well. It seems to be quite a big one. 'Cause
Yeah.
it seems like everyone sleeps terribly these days.
Yeah.
Uh,
Yep. Peptides interact with serotonin to increase sleep. They reckon that sleep depth or quality of sleep is improved.
mm. And that in itself helps with obviously like repair and muscle building and stuff, doesn't it? Like if you obviously want to be at the top of your game, one of the big components of that is you need to be getting good quality sleep. So
Yeah.
if one of these compounds can assist with that, then that's going to be
Yeah,
a bit of
I
a
think
game
one of
changer.
those responsible is thymosin alpha 1, and also this one called GHRH, which is growth hormone releasing hormone.
Yep.
Those two were like really high on the list of helping sleep, but I think overall, generally, peptides can help with sleep maintenance. I know there's the 1295 CJC with ipamorelin combination. That one there is pretty good. It's so 1295 CJC you can have on your own as a peptide, and I believe that combined with ipamorelin helps extend the effects of the peptide. So the 1295 CJC, it helps extend it over time, because obviously if you're taking a peptide, the effects of that have a window period of there's a window of it working. If you can extend that window, which is what the ipamorelin does, you're getting a better benefit.
Yeah, you obviously don't have to take as much either, so you can reduce the frequency of your dosing and that sort of thing.
Exactly.
Yeah, I read with that CJC 195 and the ipamorelin, you can extend it right out to sort of like a 7-day sort of window of effect.
Yep.
And also read that it can increase depending on your dosage and your individual sort of biochemistry. It can increase your growth hormone between 2 and 10 times over baseline. So it's quite a significant increase.
Yeah.
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 Like if you're in sort of later life, that's going to be a pretty big game changer if you're
Definitely.
struggling with sort of sarcopenia or just trying to make some changes.
Yeah.
Because like you said, you've got that sort of drop off of growth hormone every year. So that boost is going to be pretty beneficial.
Yeah.
Yeah.
Is that one to cycle on and off, you think? I don't know, is having elevated levels of growth hormone all the time a good thing? It's growing everything, right?
I think
so. If you've got
you've
got issues, if you've got cancer cells that whatever it is,
Yeah.
you're on growth hormone, does that proliferate the growth of cancer and whatnot? I don't know.
Did you find anything on that, Roo?
I did. I did see that there was some sort of cycle that you should follow. So, say for example, the one we're just talking about, the 1295 CJC, that was roughly a 3 to 4 month cycle that you're on it. So I'm just assuming that you would go off it for roughly that same time, or even at least a couple of months before you went back onto another cycle.
Yeah.
The ipamorelin, I think, was 2 to 3 months
Mm-hmm.
of a cycle of taking it. So then I'm just guessing that you would also take that as a cycle off it, the same duration.
Yeah, I've seen 3 and 1 kicked around a fair bit. 3 months on,
okay.
1 month off.
Okay, yeah.
I guess the problem with this is again probably mostly anecdotal stuff, because we haven't had those like larger human trials where they've mucked around with it and mucked around with dosing.
Yeah.
So I would imagine a lot of this has probably come from the bodybuilding community and like the elite sport community, and they've sort of worked out what works for them.
Yeah.
I think CJ, you're probably right. Like I don't think it's recommended if you have cancer, because you're obviously going to get that cellular proliferation, which you're trying to avoid.
Yeah.
And
that you could probably recommend that if someone is considering taking some peptides, go and have a cancer screening test. You can get blood tests that test overall cancer levels in your
Mm.
blood, would it even be worth just doing that?
Absolutely.
It's not
I reckon
expensive.
You'd want to have. I reckon we talked about blood work and having baseline levels of whatever it is, thyroid stimulating hormone, liver function, kidney function, A1C, blood glucose, lipids, all that kind of stuff. I reckon you'd want to have, I don't know, 4 or 5 years of baseline of what looks normal, testosterone maybe as well, and then get some blood work done if you're going to do it before and after, just to make sure that things are staying where they should. I reckon I mean, we're not doctors or anything.
Yeah, and we should make that clear that we're not, prescribing anyone anything. But if you were considering taking it, you might want to just do some prep work on your existing health levels.
Yeah, you're going to spend some money on it, aren't you? Like, they're not expensive, but they're not dirt cheap.
No.
So if you're going to go to the expense of doing the research, what you're going to take, and you're going to spend the money on it, then spend a few extra bucks. And like we said on the show before, you can organise your own blood tests if you like, if you don't want to go to a doctor.
Yeah.
But you obviously can go if you've got a good GP and ask them to get some of these tests. And some are quite good at writing them. Others are a bit standoffish if you want anything over just a simple cholesterol test. So
even that website, iMedical, I reckon that's fantastic. I think it's i-medical.
Yeah, iMedical and iScreen in Australia are both really good.
Yeah, it's like for anyone that hasn't seen it, it's like a little click boxes and drop down boxes. So you can click on one sort of area that you want tested. And you click on that, and then a whole series of drop-down boxes will open up. Mm-hmm. You just tick which ones you want tested, and at the end of it, you'll just have a total amount that's payable. You go and get your bloods done. It's sent to New South Wales, I think it is, and it comes back with all your results. It's really quite seamless, and you don't need to go to a doctor to get it done.
Yeah, well, it's discreet as well. I mean, it's private, so it's not going to end up anywhere you don't want it.
Yeah.
And if you really wanted to nerd out, if you really wanted to be scientific, you could even test your IGF-1 and your growth hormone levels before and after if you really wanted to see the effect of this, and if you wanted to work out, like, is this product I'm getting effective?
Yeah.
Am I getting something that's actually having a good biological effect? Like, am I spending my money wisely? It would be quite interesting. I'd be interested to see.
Well, it's especially definitely using one of those, because sometimes you go to the doctor and say, can you test my IGF-1? And they say, well, why do you want to do that? There's no symptoms to do that. And they say, no, I'm not doing that. There's no reason for you to do that. Okay, well, I just want to check.
Yeah.
Well, that's not a good reason. So those iMedical and iScreen are good ones to, if like you say, you want to nerd out and you want to have some control over what you do with your body and say, okay, well, I'm trying to be proactive here. I want to be healthy till I'm 100 or whatever.
Yeah.
That's a good way to do it.
Yeah,
check that out, because some doctors aren't, unless you are going in saying, I have these symptoms, okay, we'll test for this then, but they're not going to help you out.
It's just easier sometimes, isn't it? Just go online, draw your own test up.
Yeah.
I've done IGF-1 before when I was doing a fair bit of fasting. I just wanted to see where the level was at.
Yeah.
I've never had any reason to test growth hormone, but I've done a number of tests, and you can get quite a lot of tests for, like, say, $100.
Yeah. Yeah.
Which is a lot of money, but you might pay $60 to go to the doctor, depending on if you've got a bulk billing doctor or not. So
that's right. Yeah.
It's not too much more.
No.
Some other benefits?
Mate, you hit the nail on the head for a lot of them. So exercise recovery is a big one, isn't it? And sort of reduction in inflammation, increased repair, increased muscle size and strength. So you're going to stimulate muscle protein synthesis.
Yeah. Fat loss.
Yeah, that's a huge one, isn't it?
Yeah.
Increased, growth hormone. The PT141 is quite interesting. Sexual desire one. So
there's some
into that one. But
peptides that you can take for libido and erectile function.
It seemed that one worked very well for the ladies.
Yeah, I read some clinical studies on that PT141, and it was sort of like developed and tested a bit as a female treatment for sort of like low libido or all that sort of thing. It actually seems to have like pretty good effects.
Yeah. Okay.
So if you're a woman and you're struggling with your libido, PT141 definitely seems like a good choice.
And that comes in a nasal spray apparently.
Does it?
Yeah.
Yeah. Okay. Yeah. There you go.
Because a lot of these you can take by injection.
I think most of them are more effective injected, aren't they?
Yeah.
And that's maybe one of the reasons why they're kind of looked upon a bit. It's got that.
Totally agree,
It's
mate.
got that anabolic steroid 80s guy of shooting up with your with your hypodermic needle.
Back
you kinda-
alleys.
yeah.
As soon as you mention anything with an injection,
Yeah.
it has this cloud of illegality
Yeah.
around it, you know, or
Except vaccines, David.
Oh,
Let's
yeah,
not talk
you know,
about that,
they're-
sorry.
Get some more of
We've
those.
got a couple of strikes already.
no, but they're all right.
Yeah.
But there's also increased brain function and mental health. Some opioid peptides. Both,
Is that right?
Yeah, both androgynous and exogenous.
Endogenous and exogenous.
That's the word I was looking for. So one is what's the definitions there?
So one is the endogenous one is produced by your body,
Yes.
and exogenous is
One you
like
take.
introduced into your body.
Gotcha. Yeah. They bind to certain receptors to the brain. They may benefit the nervous system and decrease stress and anxiety. Some for pain relief as well.
Yeah, I think that BPC 157 had some neuroprotective effects, didn't it? I saw some studies of that peptide, and they'd done different experiments on rats, and they'd done ones where they crushed their spinal cord, and then they treated them with BPC 157. They had a control group as well, and the ones that had been crushed and treated with the BPC 157 actually had pretty miraculous recoveries.
Wow.
So that's obviously nervous tissue that's being like salvaged there or repaired.
Yeah.
So I think BPC 157 definitely has some really good like neuroprotective
Yeah.
nerve regeneration
That's amazing, eh?
applications. Yeah.
It's interesting though, isn't it? That'd be very difficult to replicate on a human. I guess that's why a lot of the studies that you read about with peptides are all done on mice.
Yep.
It's maybe not ethical to break someone's spine.
Yeah, I
on a
only
human,
found one.
it's just
Sorry.
Yeah.
Yeah, I only found one study on BPC 157 in humans, and it was people with knee ligament injuries and pain. I think they injected it actually into the knee or around the knee or something like that. And 11 of the 12 people who got the BPC 157 had like an amazing reduction in pain and increase in healing and all that sort of stuff.
Wow.
But like you say, they're not really going to be crushing too many human
Yeah.
spinal cords, are they?
Yeah.
It's interesting. I've read a little bit about that local effect of you're putting BPC into the joint that's an issue. Say my shoulder, you put that in the shoulder. That I reckon they say that local effect is a bit of a myth. I mean, it's still going to get there, but putting a needle in is not going to get to the exact point. And there's sort of muscle, interstitial fluid. There's a lot of stuff before it gets to the site of the injury, and they reckon it's taken away by the bloodstream anyway. So even if you are injecting it into your sore site, I don't know what that study said. I just looked into a few myths and stuff that were around peptides, and one of them was this local effect that you can put them into your knee and it miraculously heals your knee area, but it's probably taken up by the bloodstream and then ends up getting back to your knee anyway.
Yeah.
Just because there's that gap in between. Yeah.
That makes a lot of sense, doesn't it? Like it seems to be what it will really be.
Yeah, and also when you do sort of do a search for peptides, collagen peptides always seem to be the most popular one that pop up. So a lot of obviously increase in skin health can be achieved through collagen peptides, improving the structure, your strength and elasticity of your skin, decreasing wrinkles and skin dryness.
Yeah, well, they're a real darling of the supplement world at the moment, aren't they? Like everyone seems to be recommending and taking collagen, like say for your skin and for muscle and tendon and ligament repair and that sort of thing. But I guess, like we discussed earlier, those are mostly taken orally, so they're probably a lot more accepted.
Yeah.
People will pop anything, in a drink or whatever and chuck it in your protein shake, and it's sort of very inert.
It's okay,
but
yeah.
you're essentially still taking a peptide, just a collagen peptide, but because it's just ingested orally, it's a lot more accepted. Even though it's going to sort of have the same effects in terms of it's still a peptide, it's still got a biological effect. It's just
the way it's taken.
Different route of administration.
And going back to that erectile function libido one, the PT141, there's another one that can increase testosterone production, and that was called Kispeptin, KISSPEPTIN. I don't know if you guys come across that one.
Didn't, mate, no.
No, I didn't see that.
I got that one from this doctor who was sort of going through a whole list of different types of peptides and what they're renowned for or what their benefits are. Kispeptin.
So that upregulates the body's own production of testosterone and increases your levels a bit.
Yeah.
Yeah. Do you know sort of how effective it was? Did he talk about
He
how
didn't,
much
mate.
it increases? Or?
Nah, I didn't delve into it. I just got the name of it and thought that was quite interesting. Longevity. Some animal studies have shown the use of epitalon, EPITALON.
Yeah, I came across that one.
Was shown to increase a lifespan in some animal studies.
Yeah, was that the one also that helped with skin health and also I think hair?
Yes.
Like growing back your hair.
Yeah.
Suffering hair loss.
Yep.
There's one, it's a good one. What was it? GHK, copper peptides are good for you growing your hair back, apparently.
Oh yeah.
Which I don't know.
There's so many. There's so many.
Full heads of hair.
Yeah, so many different peptides. Obviously, because there's so many different peptide chains that we have in our body that
it's
are
almost an unlimited amount you can make, isn't it? Because you think of all the different amino acids. You know, there's 20 different amino acids in the body, like 9 essential and 11 non-essential. You can put them together in any different combination you want, different lengths, and that is a peptide. So who knows what's out there that we haven't thought of yet?
Yeah. Add another link to the chain, and
yeah, exactly. Yeah, I'm sure there's all sorts. Definitely the two most popular ones I came across were the CJC 1293 or 1295 and the BPC 157.
Yeah.
That TB 500, I think, which is sort of a version of what the Bombers were, or one of the ones the Bombers were taking. That's that one that's very good with injury repair and avoidance and stuff like that.
Okay, yeah.
They were also taking, they were taking thymosin beta 4, but some places refer to that as TB 500.
Yeah, that's
gotcha.
Right.
I did take a note of that. So going on to that Bombers case, thymosin beta 4. What do you call that? What was the other one?
TB 500.
Yeah. So
right. That was known for promoting cell migration to form new blood vessels and regenerate tissue, decrease inflammation around joints, and to increase mobility. That one there was deemed illegal by the World Anti-Doping Agency, or WADA, but I don't believe it was illegal by ASADA, or it could be vice versa.
Is that right?
Yeah, so one of those, so there's WADA, and ASADA is the Australian Sports Anti-Doping Agency. It was not illegal with them, but it was illegal with the other one.
Yep.
So that's where a bit of conflict arose.
Yeah.
They were also on one called AOD 9604, and that's a peptide for muscle and cartilage repair.
Okay.
Yeah.
Yeah. So they definitely weren't taking something that was just going to get them fully jacked and make them into physical specimens.
Quick and
the other stuff I saw for that TB500 was it reduces inflammation, and it can also assist with like skin wounds and even the repair of heart tissue.
Right.
So I mean, it actually sounds like a really beneficial thing if you're an athlete.
Yeah.
No one likes to see athletes get injured.
Yeah.
No one likes to see an athlete in their prime get an injury that sort of takes them away from the game and potentially ruins their career. So, I don't know, is there an argument that maybe you should let them have
definitely
stuff like that? I mean, just as a useful adjunct.
Yeah.
You know, it'd be like saying, whey protein will help with, muscle protein synthesis. You can't have that because you're going to...
Yeah.
Where do we draw the line? Like, it's a peptide. It's a sequence of amino acids. They're not injecting crack into their eyeballs. So
that's right. Yeah.
You go like, well, is it the worst thing?
Yeah. And you hear these commentators on TV talking about, the incidences of soft tissue injuries and all these knee ACLs and PCLs, all these injuries are going on. Like, there are ways that you can prevent them, or if they do happen, let players recover a lot faster from them. Yeah,
you're at least going to minimise the chance. And if it's got an anti-inflammatory effect as well, then it's going to sort of reduce that massive inflammatory burden that they'll have in their body from playing a full season of footy or whatever your sport code is, and getting all those knocks and niggles and all those things, and your body's constantly trying to repair. And obviously you don't want to have no inflammation, but you also don't want to have it through the roof. You want to find that happy balance. So I mean, if something helps with tissue repair and the angiogenesis, like you spoke about, the creation of new blood vessels, like that doesn't sound like a bad thing to me.
It
also helps with the nervous system and the eyes, that TB500. So I mean,
TB500, I might make a note of that. So that's a thymosin beta 4.
It is, I think TB500 is just less of a mouthful. They seem to give them all these little coded number and letter names, don't they?
And ridiculously, additional there with Essendon, they were also taking colostrum,
Oh yeah.
which was a part of their case against them, which is just
That's not banned, is it?
it's a milk. It's
in breast
it's
milk.
in breast milk.
Just
Yeah.
in the first few days of breast milk, the
Yeah.
mothers express colostrum to help the babies with
Exactly.
their immune function.
So that increased their antibodies and antioxidants. They were also taking tribulus,
Oh yeah.
which is a plant.
T booster.
Pardon?
Tribulus terrestris, the testosterone booster.
Is it? Yeah,
It's
yeah,
natural.
yeah. It's a natural plant. Supposedly, it's not really determined as fact to increase hormone levels like testosterone. So they were the major things listed there when you do a search for what the Bombers or Essendon Football Club were alleged to have taken.
Did they get done for the tribulus, or was that allowed? Was that on the banned list? Do you know?
I don't know, mate. I don't think those last two, colostrum and tribulus,
'Cause surely
are on the
colostrum
ban
or-
list.
I mean, yeah.
And that tribulus is a natural
You
plant
can buy that
product.
from anywhere.
Yeah,
Like it's not like it's some black market. You
No.
know, go into the alleyway and get a little paper bag of tribulus. Like
Yeah.
you go to Top Nutrients or whatever if you want to. Or,
exactly. But I think that was just the list there that they had provided. The first two that we spoke about, the thymosin beta 4 or TB500 and the AOD 9604, that was the other two big ones.
Yeah.
But obviously aimed at recovery and
Yeah.
reduction of inflammation.
Yeah.
Yeah, which you could deem loosely as performance enhancing generally overall.
Yep. Yeah, if it assists with recovery, it's enhancing your
Yeah.
performance, isn't it?
But is it any different than what they do after a game and go and wade in the cold water
Don't
in
have
the
an ice
ocean?
bath or
You know,
don't-
have an
yeah,
ice
yeah.
bath. You know, is it any different than that?
Yeah.
You know,
Don't take your collagen peptides.
yeah, yeah,
No, they're all right. Yeah.
yeah. Yeah, interesting.
It is. It's a very interesting, like, nuanced little area, isn't it? Like, yeah, it's a shame there's not more solid clinical studies, and it's just about money. Like, I mean, because pharmaceutical companies are going to struggle to make money off this,
Yeah.
and they can probably come up with more sort of pharmaceutical-directed products that will rival these. They don't really have the motivation to chase it, do they? Like,
Yeah,
it's, yeah.
and I guess that could be seen as an advantage that because they can't be patented, you don't have any big pharma influence or control over them. So they
And
can
people
be.
are just making them, and
so-
getting a quality product out, and the
Yeah.
the quality of a product will
Yeah.
determine who buys it, I suppose.
And you can do your own research within the industry you're in. So say you're in bodybuilding or exercise industry, you can do your own research and find out, or even people that have used them. You know, like I know guys that have used them and they do modelling work and that sort of thing, and they're a wealth of information and experience in their use.
I guess the only
Melatan.
Sorry?
Melatan. What's that one? Turns you brown. It's a
Oh,
peptide.
Oh,
Melatan.
yeah, right.
Melatan.
So it gives you a fake tan sort of thing.
Yeah.
Right.
Bodybuilders use it, I think.
Yeah,
Yeah.
it slowly turns them orange.
Yeah.
Mm.
Look like an Oompa Loompa.
Yeah. Oh, that's a peptide.
Yeah. I guess the only advantage of if the pharmaceutical companies really sunk their teeth into this is that you would be guaranteed a certain quality, like they would have quality control, they'd be able to test in a lab, like this will definitely have this biological effect. Whereas at the moment, we're sort of on shaky, people that do access it, they're on shaky legal ground, at least in Australia, and you mentioned in America as well, there's sort of banning them.
Yeah.
So you've got to go to different ways of getting it, and you can buy it on Australian websites and things like that.
Yeah.
But I guess the thing is you don't know exactly what you're getting
Yeah.
because it hasn't been through, the standardised testing that sort of pharmaceuticals and that would go through. So I'm by no means a fan of the pharmaceutical industry, but I guess that regulation of, knowing that you've got, it is what it says it is, would be somewhat of an advantage.
Even then, though, as we've seen over the last 3 or 4 years, some of their studies are questionable.
Oh, totally. Yeah.
And a lot of their studies are lobbied by certain groups, and influenced by that lobbying or that funding.
Yeah, well, we've definitely seen problems with, don't want to say it, but certain rollouts of certain products have not met safety or not met sort of quality control at times, and there have been side effects and things like that.
Exactly.
So there's still no guarantee.
Yeah.
I guess what I was saying is it's just a shame that because these seem so possibly beneficial that you can't get just like a guaranteed you don't know the person that's making them, I guess is what I'm saying.
Yeah.
You've got to
But
trust a third party.
You do, and you did mention those websites that you can buy them on in Australia, and some of them have a lot of information on there.
They do.
To the point that you sort of think, well, I sort of trust this information. It sounds quite legit. It's coming from a quite a scientific sort of background, and just because it's not sort of legalised in inverted commas doesn't mean it's wrong.
No, not at all.
These guys obviously specialising in it, and they know it, and the information on there is quite good.
And also, mate, the reviews people leave.
Yeah.
Like, I mean, you obviously can't guarantee that the owner of the website hasn't gone on and just written a zillion reviews, but
a few bots
or whatever, pay some Russian bots to.
Yeah.
But like, I've been to a website you guys probably seen called Peptides Australia.
Yeah.
It's a very good website. It's, colourful and flashy, and seems to have a lot of information.
Peptide Australia.
Yes, Peptide Australia.
Yeah,
not
but
Peptides.
it's called Peptides Australia, the website.
Yeah.
The web address doesn't have an S on it.
Oh, really?
There you go.
Because I was like, oh, is that a bit sketchy?
Yeah, right.
Is there Peptide and Peptides Australia? But no.
But they got heaps of really positive reviews.
Yeah.
They sell heaps of different products and stacks and all sorts of things.
Yeah.
Biovate is a good one. BIOV8, the letter. You got to go on there. You got to do a full medical checkup.
Do you really?
You have a consult with a doctor.
Is it like an online sort of thing? Do you know?
Yeah.
Or,
Yeah.
As in, you just type in some stuff, or you actually got to talk to someone.
You type in it, initially. It's almost like when you go to the doctor. You fill out all those papers and send that in, and
Okay.
Biov8. Yep.
.com.au.
I'm looking at it at the moment. biov8.com.au.
Yeah, right.
Yeah. So fill in your details.
Okay.
Yeah.
That's
then they
not
do
a bad way.
Zoom telehealth conference.
Yeah,
kind of
right.
thing.
And it looks like they do blood work here, possibly as part of that process. So I'm just sort of clicking on it as we speak. So there's definitely ways you can do it. I think letter of the law, they're not entirely legal in Australia for personal use. I'm sure with a doctor that would be different, although you had that experience you were talking about. Where it seemed to sort of be on quasi shaky ground. But
I think when you buy them, everyone has a label on it saying this is for research purposes only. And when you go onto those websites to order them, it does say
not for human consumption.
Yeah, or for research.
Buying it for my cat.
For research purposes only. So I guess that's some sort of little crack in the legislation that they can get away with providing them.
Yeah.
For research purposes.
Yeah, it's just interesting that website there has. I think that says they have doctors that prescribe them, which must mean that you can do that as a doctor. I guess if in the clinic you're going in to see the doctor and you're saying I've got this and this, can I try peptides? I don't know. Maybe there's doctors that are willing to do that. I don't know. I didn't read anything about doctors being in trouble for prescribing peptides or anything like that. But if you go to the TGA, or whatever, there's often people getting in trouble for doing the wrong thing. Too many giving out too much growth hormone or testosterone.
Doctors are really on a tight leash these days, aren't they?
Oh, yeah.
They do all this training and they're these amazing, wealths of knowledge, but they're so hamstrung in that, like, they're not really allowed to use their clinical judgment anymore.
Yeah.
They've got a very strict, seems like, set of guidelines they've got to follow, and if they step out of that, they can be cooked. Like, if they take them, I know some doctors during the COVID stuff were doing alternative therapies and they were working with like vitamin D, and some of them were obviously giving like hydroxychloroquine and other things like that, and they really got hung out to dry, and they sort of had a leg to stand on because their stuff was supported by science. But it seems like that doesn't really matter. Like if the AMA, the Australian Medical Association, or the TGA or whatever just decides you guys aren't allowed to prescribe this, then it seems like we don't really trust doctors anymore to make their own clinical judgment on a one-on-one basis, which I think is a shame. It seems to be getting tighter and tighter all the time, really reining it in. So it's a bit like the doctors that prescribe like testosterone replacement therapy and stuff like that. I think they're tightening that up more and more. It's getting harder and harder to sort of go and just say, oh, I'm an older man and my testosterone's in the floor, I want it to be back to where it was when I was 30, sort of thing. And I think that's getting tougher.
However, not as tough though if you're a 13-year-old girl who has gender dysphoria and says, I want to change to be a boy.
That's different, mate.
You can get testosterone in 5 minutes.
That's
Did you see that? There's this thing online where a girl went into one of those gender affirming care sort of joints and was prescribed testosterone within 5 minutes of the consultation.
Wow.
Yeah.
Yeah, big dudes going in with wigs on, pretending to be girls.
Anyway. So yeah, peptides.
Yeah.
Yeah, this
Interesting.
is
Exciting.
super interesting. Yeah.
Yeah.
Be interesting space to watch. I guess the last thing, well, we touched on safety a little bit, but just the, how safe are they? Where are you getting your source from? A lot of the stuff that I read was that you couldn't really have too much of them. It's not that you could overdose on them. It's just that, you're probably wasting your money by taking too much.
Yep.
Yeah, it was just very little side effects for most of them.
I can spoil your
Made
party a
by-
little bit if you want a couple.
Oh yeah, go on.
Depending on what it is, they said like skin irritations at the injection site, which is pretty much for anything.
Oh
So
yeah,
if you get
yeah,
that, there's a lot of people feel flushing, so you feel like quite flushed for a few minutes after taking it, which then rapidly subsides. The only one I saw that sort of maybe go a bit like is one of the side effects of having higher growth hormone is it'll mess with your blood glucose a little bit, so it can push up your blood glucose levels a little bit. So just something to sort of be aware of if you're considering it.
Yeah.
Apart from that, they don't seem to be
No.
It
terrible.
really seems the benefits massively outweigh the negatives of them.
Yeah.
Some pump, like melanotan, which is that one that pumps up your blood pressure a little bit. But yeah, like you say, there's like
Yeah, like if I was going to do it, I would certainly just be watching the basics, like we spoke about, some baseline testing, maybe keep an eye on your blood pressure, keep an eye on your blood glucose, and just monitoring how you feel.
Yeah.
I don't think they're going to be really detrimental for like your kidneys or your liver or anything like that. So, I would just those basics are very easy to check. You can get a blood glucose monitor for $20 or $30 down at the chemist, and blood pressures, same sort of thing.
Yeah. It's just a matter of removing that stigma of something that's injectable. Like our good friend Bulldog. Kudos to Bulldog. Shout out to the man.
The bulldog.
He had a friend who, when they were discussing peptides, just in an overall discussion, this friend of his said, "Oh yeah, but you're on the gear then." So the term, you're on the gear, which would be implying that you're on steroids. To which our friend said, "Well, no, it's not. You're not on the gear. Peptides are totally different than steroids." But that just seems to be the perception that if you're on peptides, you're on the gear, so to speak. It's nothing like that.
No. Well, I'll tell you categorically, if I do another bad like musculoskeletal injury, like I've had shoulder surgery and done some stuff like that, I'm going to try BPC 157.
Yeah.
It's not a performance enhancing thing, but the effects for recovery seem to be really good.
Yeah.
And when you've got a long recovery, I think anything that can help you would be a bit of a game changer. So I wouldn't hesitate to say if I ever do another horrible injury, touch wood I won't.
Yeah.
I reckon I'll look into that.
Could even be something for you to consider, CJ, about your shoulder.
Yeah, definitely. Yeah. It's coming good, but I don't think it'd be too bad just to take every now and then as an aging fella, just to, you go to the gym every now and then. Hurt my back, just to reduce that sort of
bit of inflammation.
Or strengthen and increase your tendon strength, your muscle strength. Just to prevent those injuries actually happening. I think that some of them show some real promise.
Because you go down the shops or you're walking down the street and you see an old fella bent over, and he's taking little steps, shuffling along, and you think he's skinny as but he's got no muscles, he's got a bit of pot belly, and you're just thinking, man, if he had the knowledge of peptides possibly when he was younger, or when he was hitting 50, 60, maybe he might be walking upright and taking longer strides, and he might be stronger and he's less likely to fall or break his hip or something like that.
Maybe it could even help him in his current state.
Yeah,
most definitely. So I reckon they sound good. I just want to talk quickly before we finish about Ozempic, this weight loss one. I've got some crazy stats for you, because I've heard a few podcasts lately. I listen to a lot of podcasts, and a lot of people talking about it, and it seems like, particularly in America, but in Australia it's gaining a lot of popularity too. A lot of people seem to be moving to this band-aid fix of Ozempic for weight management, and they're touting it as a type 2 diabetes sort of management drug as well. But man, it looks terrifying to me. Like, I don't know if you guys have delved into this at all.
So firstly, Ozempic is a treatment for diabetes.
and obesity. Yep. So,
But it was originally designed for diabetics. Is that right?
I'm not sure how it originally came about. So it's
It was
peptide.
weight loss,
I
wasn't it?
think it might have been
Yeah.
weight loss
Okay.
treatment, but it's touted as a management for type 2 diabetes, so blood sugar control. So semaglutide is the name, as I mentioned before. So it seems like it really helps you lose weight. And I'm sure when you lose weight, you know, obviously reducing the amount of fat your body's carrying, you're going to sharpen up your insulin sensitivity. So it makes sense to me that it's going to help with glucose control to a certain extent. But man, some of the other like adverse effects. So straight away, if you go on the Ozempic website, they have a risk of thyroid cancer. So this is a straight cut and paste. I'm just going to read it out from the Ozempic website. Ozempic may cause serious side effects, including thyroid tumours, including cancer. And it goes on to warn you to tell your health provider if you get lumps in your neck, hoarseness in your throat, trouble swallowing, all that sort of stuff. In studies with rodents, Ozempic and medicines that work like Ozempic cause thyroid tumours, including thyroid cancer. So straight up, that sounds like a terrible product to give your kid. If you've got a little 12 or 13-year-old kid who's obese, maybe think about not giving him something that can possibly cause...
So this is straight from their website?
This is straight from their website. I cut and paste that.
Okay.
So that's word for word.
Yeah.
If we go on a little bit, as I said, it's got amazing weight. It'll make you lose weight, right? So people were getting quite significant weight loss. So some people were getting 10% reduction in body weight in like 1 or 2 months. So really, you know, quite big. But if you look at what they're actually losing, so I looked at some research here. It was only a smaller group, so 140 participants. So on average, it was actually a 68-week trial. They lost 15 pounds of lean muscle, 15 pounds of lean muscle mass.
Wow.
This is mostly going to be older people, and 23 pounds of fat. So, okay, so they lost, what's 15 plus 23, 38. So they lost 38 pounds, pretty significant. That's sort of getting towards 20 kilos in Australian talk. But
half of that?
Close to half, well, you know, 15 versus 23 of those pounds was lean muscle.
Yeah.
And if you look into that further, they're also seeing reductions in their bone density. So I mean, if you're an old person, you do not want to be losing, like we spoke about, your growth hormones dropping, your muscle protein synthesis is more difficult, it's more hard to hold on to muscle. This is a product that, yeah, it's going to make you look a bit better, but you're going to lose lean muscle, and that's really hard to get back.
Yeah.
Like, can you imagine so the mean age of the participants in this study was only 52. Can you imagine how hard, as a 52 man, it would be to be like, all right, I'm going to get in the gym and put on 15 pounds lean muscle? Yeah. That's quite hard.
Yeah.
Oh, yeah.
That's quite hard.
And not even thinking about the bone density issue. That's massive. Bone density, bone health is so important as you get older.
So, I mean, falls account for a large percentage of, like, you know, mortality and morbidity and stuff in elderly people. When they fall, they've generally got bad outcomes.
Yeah.
So we'll go on, mental health. So Ozempic and mental health, they studied 31,000 people, and they had a significant number of adverse psychiatric events. So it affected women more than men. So 65% of women were part of this group. So obviously 35% were men. The most common adverse event was depression, which was 50% of the people that were affected, followed by anxiety, 38.7%, and suicidal ideation, 20%.
Bloody hell.
So they actually registered 9 deaths and 11 life-threatening outcomes, essentially from suicide attempts. So,
Far out.
so you've got some quick weight loss, but you're going to lose a hell of a lot of muscle. You're going to lose some bone. You're going to put yourself at risk of getting thyroid cancer, and you're going to have the possibility of affecting your mental health.
Wow.
So if you're a person out there that's thinking like, yeah, Ozempic, that sounds good, I've got to do nothing except inject myself once a week for the rest of my life.
Is it an injection or oral?
It's an injection. It's a once weekly injection. I would think very carefully about that.
That is crazy.
It's crazy. It just enrages me that, again, we've found this another, like a Band-Aid solution.
Yeah.
But yeah, in America, they're prescribing it for kids 12 and over now, and it's becoming more and more popular.
See,
So
it's just, what a conflicting, like here we are talking about peptides, a product that obviously has so many benefits and very, very minimal side effects.
Yep.
But it's disallowed, or it's frowned upon, or it's deemed illegal.
Yep.
But then you've got this product, which, I don't know. you've just rattled off a whole heap of side effects. So it's got probably one beneficial side effect, which you could achieve through proper nutrition and exercise and lifestyle. And it's an acceptable product or a saleable product or legal. It just does my fucking head in.
It's one of those things that RFK was talking about getting rid of as soon as he got into office.
Did you catch his podcast on that the other day?
Yeah.
That was a good one, hey?
Yeah.
That's actually what got me thinking about this for the podcast today. I listened to the RFK
Oh, yeah,
thing.
yeah.
It had been on my radar a bit anyway because I'd heard Rogan talk about it and he was trying to talk Elon Musk out of coming off it because apparently Elon was taking it.
Oh, right. Okay.
Yeah, it just seems like insanity to me.
Yeah.
Just be careful.
Crazy.
I'll get that podcast off you later because I would
Yeah.
really have a listen to that.
Yeah, I think it's RFK. RFK has his own podcast channel. It's his most recent one.
Yeah.
There's a short one, there's a 5-minute one, and then there's a longer one, which is like 40 odd minutes.
Yeah.
It's very good. It's definitely worth listening.
Well, dare me repeat one of my comments that from a friend of mine I caught up with over the weekend. Who's RFK? Don't get me started there.
Well, that's not voting. He's not voting. He's in Australia, isn't he? So
Yeah.
doesn't matter.
But
He just needed to be over in the US.
Obviously, just highlights his narrow-mindedness with world events. Anyway,
I'll tell you what, if we've got any US listeners, you don't know who RFK is, look him up. I reckon he sounds like a champion. I like most of what he stands for. He's really walked the walk his whole life. He's obviously got the family pedigree of his family being in politics, but he's been like an environmental warrior out there in the trenches trying to do the right thing, clean up the Hudson River and do a number of other good things. Yeah. You could do a lot worse than having RFK as your president if he gets on the ballot. So I'll root for you, Bobby. Gotta get RFK.
Yeah.
And he's a big fan of falconry.
Loves a bit of falconry.
And in skiing.
Doesn't mind a bit of snake wrangling, catching. I saw a footage of it the other day, picking up a bloody snake.
Yeah.
Doesn't mind going to the gym either. I wonder if he's got a bit of pep in his step.
Yeah.
So, a bit of a unit.
Yeah. Good luck to him.
Yeah.
All right, before we head into another topic of US politics, should we finish off there?
Sorry, I went off on a tangent.
No, thanks, boys. That was good. Interesting topic.
Yeah.
Very.
Definitely keen to give them a go on the quiet.
See how we go.
Very compelling.
Yeah. Come back all jacked. Months.
He's already jacked. Look at him. Bursting out of his jumper over there.
All right.
All right.
See you next week.
Yeah,
Cheers,
see you
lads.
later.
Air guitar.